mandibular osteopathy, it often will go away without treatment at all. And sometimes it goes away because the veterinarian gave antibiotics or steroids, but the secret is a lot of them just plain go away. And on this particular dog, we did utilize steroids for a long time. This view here is showing solid bone on an x-ray, but this is all extra bone that's developed. So this is a massive lesion, and it took a long time for that to resolve. So back to the topic of this presentation. Why are we here? We're here because I want the Door County Scotty Rally people to realize that it's up to them to be an animal advocate. And I want each of you to do your own oral exams. Every time I've come up there, I've done oral exams on dogs that I don't know very well, but you know your dogs very, very well. And if you do oral exams every day, i.e. brush the teeth every day, you will know their mouth really well. So if all of a sudden something pops up and there's a swelling, it doesn't have to become a big tumor. Or if there's a tooth that's chipped or cracked or whatever, you could identify that. How would you be that good at identifying it? Because your dog loves you as much as you love, I laugh a little bit, as much as you love them. And they will love you looking in their mouth. They want your attention all the time. I am gonna get back to the pictures here. I want to see faces. For sure, these animals love us as much as we love them. And if we are calm and we are patient and we are gentle and we're understanding, we can do oral exams. That's my message. And you can find problems. And once you find problems, you can ask Michelle, or you can ask Matt, other people in your group. You can ask your vet, and you can ask a veterinary dentist what's going on here. So if you see something potentially a problem, don't sit on it. Look for an answer. There's always a solution. So how do we do an oral exam? Calm, patient, understanding. And if it just isn't the time to do it, give it up and do it a different day. Don't force it. Don't force their mouth open. I purposely, intentionally put this slide of someone that came in my office and they're forcing their dog's mouth open. That never goes well. It never, ever goes well. Calm, patient, kind, gentle. That's what you need to be. Don't open their mouth. Just lift up the lip and have a look. Can you see the teeth? Can you see the gums? Can you see the tissue above the gums called the oral mucosa? And when you lift the lips, you're able to sort of pull down the lower lips and lift up the upper lips, and you can see the upper and the lower teeth. You can look at the teeth on the top and the bottom, how they look. Do they look white? Do they look tan? Is the tan due to calculus or tartar? Or is it due to discoloration? Look at the gums. Does it look smooth? Is it pink? Is it lumpy, bumpy? Can you see the tongue? If they do, they're going to open their mouth. If you see the tongue, do you see any mass or any string wrapped around it? One of the things you always want to look at if a dog is acting like it's uncomfortable is there something wrapped around the base of their tongue? It's a classic magnet for string and rubber bands and things like that. Always look at the base of the tongue. The roof of the mouth, can you see it? And if you can, does it look like it looked yesterday? That's the point. If you do an oral exam every day, you can see changes. So look at the roof of the mouth, look at the floor of the mouth, look under the tongue, look at the tongue, look at the gums. So look around, see what you see. How many teeth should we see? Well, it depends on how patient you are and how well you can see in the mouth. It depends on the age of your pet. That 2-2 is interesting because I removed the 2 twice and it popped back up. Are there missing teeth? Are there extra teeth? How would you know? Well, I teach people how to look in their mouth. This is a view here of Sparky, and Michelle is probably smiling. And they don't like being on a metal table. The metal table doesn't feel very warm. It's easy to clean, but it feels very unnatural for a dog that wants to be in control. So having a dog on a table is different than having them in your lap. But so if we're going to do an oral exam, we have to really be kind and gentle, and we have to respect them as well. So here's the way we go. A treat really can help in the examination process. So if I had a poll, or if I were standing in front of your group, I would ask you a question. How many baby teeth or primary teeth do they have at birth? How about at 1 week? How about at a month? Do we know? Many of you have had puppies, and how many of you have observed the teeth? It's a funny thing because everyone looks at their animals, but how many of them look at the mouth? So my point being is, if you don't know the answer to any of these questions, are there any teeth in the mouth at birth? Maybe, just maybe, it's time to start looking. And if you look every day, you'll learn something new every day. And with puppies, they're always putting things in their mouth. And that's a good opportunity to take those items out of their mouth, because what you don't see might hurt them. And it might cost you a few bucks too. So have a look regularly. So this question about how many teeth do they have at birth is a really pertinent question. When do the baby teeth come in? When do the permanent teeth come in? And why do they come in? Well, it turns out that as teeth do come in, as the baby teeth start to exfoliate, this picture down here is showing little pieces of teeth that we see. Those are called, well, they're exfoliated teeth. They're called capped teeth. They're called a lot of things. You'll step on them on your kitchen floor and you'll wonder, oh boy, they broke a tooth. And really they didn't. If you kind of know at what age they start losing teeth, that's normal. If they don't lose their teeth, that's a problem, because 2 teeth cannot be in the same place at the same time. So if the baby tooth did not leave the mouth, the adult tooth that follows it has no room, and that creates malocclusions. So I put up this little slide just to show you that the answer is that at birth they don't have teeth. I wonder how many of you knew that. I'll bet you most of them, knowing that you're Scotty owners, you all are ahead of the curve, and so you know that at birth they didn't have teeth, but at about 3 to 4 weeks you're going to see incisor teeth, and they come up really fast. It tends to be the central incisors. We number them number 1, the ones right in the center, and then the canines, and then the premolars. If you look at a puppy's mouth, you'll notice big bumps in their mouth, and that's teeth that are trying to erupt through the gums. So the primary teeth are baby teeth. The secondary teeth are the permanent teeth, or adult teeth. And so oddly enough, there is somewhat of a predictable schedule to eruption. So as the baby teeth erupt, the adult teeth come in, and the baby teeth should all be in by a few months, and the adult teeth, the baby teeth should all be in, by about 12 weeks, which is 3 months or so. And the adult teeth are all going to be in probably by 9 months. This slide here shows 6 months, but the molar teeth are the last to come in. And so it turns out that baby dogs have baby teeth, and they only have 28 baby teeth. And the reason is there are no baby molar teeth. So it turns out that they only have 28 baby teeth, but they have 42 adult teeth. It's interesting. I teach this to veterinarians all the time. A lot of veterinarians aren't totally sure on how many baby teeth and adult teeth there are, but it gets to be easy to remember because you only have incisors, canines, and premolars in the baby dentition, but the adult dentition have molars, and they come in at 6, 7, 8, 9, and 10 months. And so on the lower jaw, when you're looking in your dog's mouth, let's say you have an adult dog. Let's say you have a dog that's now 5 months old, and in theory, all the baby teeth should be gone. The baby teeth don't always read the book on when they're supposed to be gone. And if they don't leave, like some of these little breeds, you'll have both adult and baby teeth at the same time. That's a problem because then the adult teeth show up in the wrong place. So we get to a point in life where they have a mixed dentition. They have both baby teeth and adult teeth, maybe 5, 6 months. So at about 6 months, I really would like to see the canines. And at that stage, at 6, 7, 8, 9 months, you'll see these huge bumps in the back of their mouth on the jaw. On the lower jaw, it's very prominent. And you'll wonder, what the heck is that? It's the adult molars trying to come in. There were no baby molars, and that's why there's a difference. And the difference between 42 and 28 happens to be the number of molar teeth that come in. There happen to be 3 molar teeth on the right lower jaw, on the left lower jaw. That's 3 and 3 is 6. And on the top, there are 3 molars on, there's 2 molars on the right upper and 2 molars on the left upper. 2 and 2 is 4, so 4 and 6 is 10. 42 minus 10 is 32. That doesn't work if they have 28 baby teeth and they have 32 with molars. Where's the other 4? It turns out that there are no baby first premolars. That's kind of interesting because when you look in their mouth, it looks like they're missing a tooth in between the canine and the first premolar you see. So that is normal. But as they develop, you're going to learn that they will have that first premolar in the adult dentition. So if you add 4 premolars, 4 first premolars, now we'll be up to 42 teeth if we have all the teeth. So I threw in teeth brushing, not because I'm going to teach you about teeth brushing. My point is, I want all of you to be advocates for your animals. And the goal of this presentation is to get you to actually have a look. If we've all looked at, yep, our dog has 4 legs, and he's got 2 eyes, he's got 1 nose, 2 nostrils. That's great, but how many teeth? So if we actually make an effort to look in their mouth every day, why not try to start brushing? Everyone asks me, when do you start brushing? And I say, when you start seeing teeth in the mouth. And now everyone here knows that a few weeks of age, you're going to start seeing teeth. And it starts out to be the little incisors that are in the front. And as the weeks go on, you're going to get the canines and then the premolars. And then later on, when the adult teeth come in, we'll have molars. So the how and when to brush is something that we're going to learn. But we're going to first look in the mouth every day. Maybe it isn't a good idea to take a toothbrush in their mouth when they're really young. Maybe it's a good idea to just take a little finger brush and just have them feel that it's okay to have somebody touch my mouth. And then maybe they'll accept that when it comes time that they have adult teeth and you're actually using a brush. So my goal of this slide isn't to show how to brush. It's to show you that if you do brush, you can see problems, and your vet isn't looking in your dog's mouth every single day like you are. And that's the message. When I look on some websites on Scotty's, you'll see a veterinarian say, make sure you look at the teeth of your dog because you need to brush the teeth. And then they say, brush the teeth at least twice a week. Well, unfortunately, the research shows that if you don't brush the teeth at least 3 or 4 times a week, it doesn't help at all. So I always say, if you do something routinely, if you do it every day and you miss 1 or 2 days, it isn't quite so bad. But if you're looking every day, you will see problems early, and that's my message. So, missing teeth. Why does that matter? Well, a missing tooth could be truly missing, or it could be broken off. So those are the things to think about. If you looked in the mouth yesterday and now one's missing, something has to click off in the head and say, what's up with that? So here's an example, and I did this intentionally, as I'm showing you on top here, that we're missing a canine on the, oops, I went too far. So here, we're missing a canine on top, and on this other, as you look over the other side, you see the canine here, but we're missing the canine here. It's bulging in here. This is the lower jaw. This is extremely common in little dogs and extremely common in the short-faced dogs where they're missing the first premolar down here. And this gap is a problem. On a baby dog, they're always missing the first premolar. We just talked about that. In fact, they're missing all the molars because they don't have baby molars and they don't have baby first premolars. But if you have an adult that's missing a canine, there's a problem. And if it's never identified, that can become cancer. So you don't want that. It could become an oral cyst. Lots of problems. So the purpose of this slide was to show you that you can look in a dog's mouth, and some dogs might not like you looking in the mouth. So I did this just to show you can use a Q-tip, a cotton tip swab, to look in the mouth, to lift up the lip. And then you can quickly have a look and you can see they have 3 little incisors on top, 3 little incisors on the bottom. You've got 6 teeth there. That's pretty good. And I also can see on this left side over here, they've got canines and they've got, well, I can't see the canines on this side. I'm gonna have to look from the other side. So we're looking at the other side. Here you can see the canines on the right side. And if we lift the lip a little bit more, we're gonna see the premolars. This is the 4th premolar. That's the most common tooth that gets broken. So they happen to have 4 premolars on the top on the right, 4 premolars on the top on the left, 4 premolars on the bottom on the right, 4 premolars on the bottom on the left. That's normal. So they have 4 canines. They have 6 upper, 6 lower incisors, 4 premolars top and bottom, and then they have 2 molars on top. And I'm not opening the mouth well enough and taking a picture to see the molars. I will say it's difficult to see the 2nd molar on top. On the bottom, there's 3 molars. There's a real big one, and there's 2 smaller ones behind that. Those are pretty easy to see. So here's a view of the mouth slightly open, and I just put this slide in here just to show you that there is a little bump here, and that's normal anatomy. It's not a tumor. It's called the incisive papilla. So as we're looking in the mouth, I bet everyone seeing this presentation can see on the left side that there's little folds in the roof of the mouth, but you also see there's a plethora of teeth. There's too many. And that's a mixed dentition with baby and adult teeth. That dog on the left is a brachycephalic. Thank God the Scotty doesn't have that problem. There's crowding, and with crowding, there's trapping of food and debris. And with trapping of food and debris, there's periodontal disease. So on the right picture, I apologize, my vacuum is coming into the room. I didn't plan on that. I may have to turn it off. Hold on. So I don't have a Scotty in here barking, but I had my vacuum coming at me. So the point of this slide is that dogs do have a mouth that's different than ours. If you take your finger and feel the roof of your mouth, first of all, you'll feel the roof of your mouth is much higher than a dog's. A dog has a very, very flat palate, and it's got those little folds, and those folds are designed to help push food in the back. If those folds are uneven, it suggests there's probably a problem, and that is a cleft palate. Here's an example of cleft lip. I've never seen a Scotty with a cleft lip, but I have seen many pugs and Bostons with cleft lip and, unfortunately, cleft palate. We see many dogs with cleft palate, and a lot of dogs with cleft palate can do pretty well, but they get chronic disease. And if their cleft isn't dealt with, they can get aspiration pneumonia and have certainly a lot of problems. So clefts are a developmental problem, and it's common in various breeds. So we also know that, unfortunately, as we look in mouths, we might see oral masses that aren't normal. Hopefully, you'll see these masses before they come this ridiculously large, and you'll get help sooner, because if you get help early, you may save their life. So looking at the palate, here we see an example, and this is extremely common to see stick foreign bodies caught in between the upper fourth premolar. So here we have the third premolar, the fourth premolar. Here we see the first molar and the second molar, and on the other side, the second molar, the first molar. This is the fourth premolar, the third premolar. This orange is an intubation tube, in case you might have wondered. So lo and behold, I've seen other stick foreign bodies, and they're common by the fourth premolar once again. I see them at least once a month, and I see them sometimes by the lower molar as well. So as we look around in their mouth, we can look at the tongue, and we can look at the floor of the mouth. It turns out that the floor of the mouth has little structures here that are salivary ducts. They're not tumors. I actually get animals in that where people think that's a tumor, but that's where the saliva ejects from underneath the tongue. And I'm sure my viewers are seeing that there's a problem here. And I've said that when you have adult and baby teeth at the same time, the adult is going to come in the wrong place. And lo and behold, the adult tooth couldn't go here where the baby tooth is, and that creates what's called base narrow. And that creates a malocclusion, which we'll talk about in a bit. Look at this tongue. What is that? Oh my God, what are these little things? It turns out that those are little papilla, and these papilla are designed to help push food in the back of the mouth. So the teeth function to pick up food, and the tongue functions to push food further back in the mouth. And this is a taste bud, is all that is. It's normal, it's not a tumor. They have 4 different types of papilla, and they all have names and they don't matter. But there are structures on the tongue that are normal. I wanted to show this because this is what we call the gums. This is the oral mucosa, and this is called chronic ulcerative periodontal syndrome, or CUPS. It's severe inflammation, and it turns out that the gum tissue, it lays on the canine tooth that's never brushed, and that contact with the calculus causes a contact dermatitis, or a contact inflammatory response. Unfortunately, that inflammatory response creates a huge problem for animals that can become a serious life-threatening situation. So if you start seeing redness up in the oral mucosa, get help before there's ulceration. So here's the next slide, and this slide is showing us, once again, this baby tooth didn't leave on time, and now this adult tooth is pushed forward. It can't fit exactly where it should. And now the adult tooth isn't going to allow room between this incisor tooth and this canine. And this canine that should fit in there won't, because this canine is supposed to occlude where that tooth is. So it leads to problems. Once again, this baby tooth, this caused this adult tooth to pop in the wrong location, and now we don't have an adequate space for the lower canine to fit as it should. So two teeth cannot occupy the same position. The adult tooth cannot be where the baby tooth is. It creates a malocclusion. It creates pain. The lower canine will come up and intrude on the palate and create a hole. It causes periodontal disease and the systemic spread of bacteria. That's what we said in the beginning. Number one, we've got periodontal disease. It's the most important disease of all diseases of all breeds of dogs. Number two, broken teeth. When teeth start to malocclude and you get tooth on tooth hitting, you get broken teeth. You get chipped teeth. You get painful teeth. So abnormal occlusions, they have three classes. Blue is not a good color on a blue slide, but class 1, 2, and 3. Class 1 simply means one tooth is in an abnormal position. Class 2 means the whole upper arch is too far forward, and so you have what's called parrot mouth, or an overbite, some people call that. There's all sorts of lay terminology. Some of it's correct, some of it's wrong. Doesn't matter. It's an abnormal occlusion, class 2 malocclusion. Mandibular distal occlusion just means that the mandibular teeth are too far back compared to the upper teeth. And then the class 3 is the guy that's got the lower jaw jetting forward. So he's got that jaw sticking out. I had a dog like that as a child myself. I worked at a vet clinic, and lo and behold, somebody brought it into the vet clinic to have a fish hook removed from the dog's mouth. So I helped the vet do that, and they never came back for the dog. They wanted to get the dog to have help, but they didn't want to have to be responsible for the problem. And that dog became my dog. And he lived to be 15 years old. I was in veterinary school. Actually, I graduated from veterinary school, and I saw him as a veterinarian, as a patient. So this is what the bite should look like, a normal occlusion. The upper incisors should slightly overlap the lower incisors without hitting. A level bite is the crown tips. They hit right on top of one another. And that's not like a real bad thing. It's just a little abnormal. When you hear about a scissors bite, the reason it's called scissors is the premolars, premolar 1, 2, 3, and 4, they interdigitate. And that's a great view when you're looking at your dog. The front view, you see 6 upper, 6 lower incisors, you see 4 canines, you see 4 premolars top and bottom. And when you look in the mouth and you see that all the time, you know what's normal. You might know what's more normal more than someone else. This is just simply class 1 malocclusion. And we can fix those, but it's not critically important. This dog's got one tooth out of normal. These teeth all occlude normally. This one's in the wrong position. We could talk for a half hour why that happened, but it doesn't matter. This one I actually treated orthodontically and got these teeth in normal position. It can be done. Whenever there's a problem, there's always a solution. It costs a lot of money and maybe it isn't necessary to fix. So we're all different. We all have different ideas. This is very interesting. The upper fourth premolar is supposed to occlude on the outside of the lower first molar. On this dog, it did not. It occluded on the inside. And we didn't do a darn thing. There was not a problem with it. It's called a reverse scissors bite. So here's a class 1, and the lower canine didn't fit into the mouth, so it tipped out and pushed the lip out. And that is treatable, but it isn't easy to treat. This, unfortunately, is a serious class 2 malocclusion. The lower jaw is much shorter than the upper jaw, and the lower canine is poking into the roof of the mouth. Normally, the lower canine fits in between the third incisor and the canine. So on those earlier slides where we showed you the baby canine and the adult canine at the same time, unfortunately, the adult canine was pushed forward. And with those dogs, if the adult canine's here, then the lower canine can't fit. And what will often happen is you'll get a tipping out of the lower canine because it can't fit in the mouth. So I'm just trying to convince each one of you to look in your dog's mouth regularly so you can identify problems and determine what is the best solution. So this is the last one, class 3 malocclusion. You got the jutting out lower jaw. The problem is these lower teeth are drilling holes into the gum tissue below. And sometimes these teeth get chipped and broken. So there are solutions to all those problems. This is an example of a dog where the baby canine didn't leave early enough and there's no space for the adult canine to fit. And on the earlier slide there, I showed you how the lower canine pushed out in the lip. This canine was forced forward and it ended up in between these two incisors. So that may work or it may not work, but it may cause problems. So what other things might we see? So number 1, periodontal disease, very common. Number 2 would be broken teeth. This is a cracked tooth and it's cracked all the way back. Why is this tooth so common to crack? Because the lower molar and it occlude together. And when they get a hard object in between, you get a fracturing of that upper tooth. Here, the fracture occurred above the gum line and created a pulp polyp. Here, it fractured and actually fractured the root as well. Very, very common. You might see discolored teeth. These 2 teeth are discolored. Well, on x-ray, they're here and they got real wide root canals because they died. So here we see an abnormal development of the lower molars enamel. That slide wants to run away from me. So that enamel there is abnormal. Something happened during the development, probably trauma while that tooth was developing. And so it created an enamel defect. Papillomas. I don't think I've seen a papilloma on a Scotty, but I am 100% sure they occur. Unfortunately, papillomas can be a very serious life-threatening problem. I have been referred papilloma, dogs with severe papillomatosis from dermatologists because they can be a nightmare. I could show you horrible pictures of dogs with so many papillomas that they can't even close their mouth. But fortunately, papillomas tend to just go away. It's sort of like CMO. The problem just tends to go away. But if it doesn't, there needs to be, for every problem, there is a solution, and we have to figure it out. So the question that I want you all to be thinking is the bite right? Is it right or not? So when you look in the mouth, is there a normal number of teeth? Do they look normal? Are they cracked? Are they chipped? Are they discolored? Do the teeth come together properly? Are they occluding properly? And we looked at this. This is a cross bite. 2 teeth are in the wrong position. Scissors bite. That's what I want you to be thinking about. So enamel might be abnormal. This was very similar to that lower molar. Something happened during the development, and some very wise person in the American Veterinary Dental College called it enamel hypoplasia. It don't matter what it's called, it's fixable. Enamel hypomineralization. If you wonder why those terminologies are being used, hypomineralization is implying something nutritionally was a foul. Something happened with the mineralization of these teeth. Guess what? During development. So that's why we are looking in the mouth all the time. So these are common problems, enamel defects, lower canines here and here. Very, very, very common. It could be due to trauma while the teeth were developing. It could be rough play. And we all know Scotties don't play very rough with one another, do they? Rough play. Well, sometimes the owner is also guilty of rough play. What do I mean by that? Well, what I mean is that chew toys can cause a lot of problems. And these were designed to be rubbery here, but look at where they're chewing. They're chewing the edges. And I can guarantee you all of these chew toys cause lots and lots of problems. Hard, bully stick, hard. All these need to go in the garbage can. Nylabone, the old form of nylon bone, very, very bad. They break teeth, they cut gums, pain, infection, damaged teeth. Here's the newer solution. These are Kongs that have different ways that you can go about working with your dogs. You can hide little treats in there. Some people put little frozen things. Oh, this is the person's clothes behind. But your imagination can lead to different things you can do with some of these toys. This is one of the newer ones that have been presented to me by a client, and it's called Go Nuts. I don't sell them, gonuts.com. This toy, a lot of animals like them. They'll chew them and it'll come up with a color when it's time to throw them away. You send it back to the company and they replace the toy. So it's a toy for life. This was a big one, and I believe it costs like $25, but you have it for their entire life. Oravet. Oravet is a chew that I like. It looks like this, very expensive. They can chew it. Their stool comes out green, but it works like dental floss. So it's very helpful in removing calculus. This was my old boy, Sentinel Sir, and he would nearly knock you over for an Oravet treat. He loved them. He also, he was a golden, so he loved anything that could go in his mouth. Veggie Dent is another example. I put this up because the VOHC label is the Veterinary Oral Health Council. If you go to www.vohc.org, you can find products designed to help make your teeth, the animal's teeth, cleaner. So there's other products. One, TDC, it's very useful for inflammation. It's very good for joint support. And then veterinarians have other products they use to help animals with their teeth and periodontal disease control. Doxyrobe, Arrestin, and others. So VeggieDent was another one that was oh so good. Very hard, they crack, but they knock off calculus. So believe me, dogs really do appreciate us, and they will appreciate an oral exam, but it's like everything else. You have to learn the right way to do it. I'll never ever forget this world-renowned behaviorist saying, you have to pick the right dog. You can train a dog to do certain things, but you can't train away the genetics. And you can train dogs to accept teeth brushing, and that is your opportunity to look in the mouth and be aware. So if you choose a puppy, you need to choose what breed you choose, and you can learn how to train that breed. You can learn the proper nutrition. You can protect them from injury. You can teach them skills that'll make them safer. Accepting teeth brushing is so fundamental to their oral health and dental health, but it is proven that if you can prevent periodontal disease, you will have animals live a healthier life. Some veterinarians say it'll increase their life 1 to 3 years. I'm not quite convinced that we have evidence that that's true. Oral health is absolutely a precursor to excellent general health. And I do want you to brush the teeth. We have a teeth brushing video that you can get live. It's a YouTube video. You Google "My Pet's Dentist" and tooth brushing video. And this video will come up showing you that you will angle the toothbrush at 45 degrees to the orientation of the teeth and the gums. I'm trying to show that angle here. And you rub in a circular manner very, very gently. You're trying to remove a film of bacteria. That's all you're doing. You do it in the front, you do it in the sides, top and bottom, and you do it just on the outside of the teeth. If you have a dog that'll allow brushing the inside of the teeth, have at it. It's perfect. It's very, very helpful. I have many clients that brush teeth regularly and present their dogs to me every 4 months for teeth cleaning. And I guarantee you, they don't have a huge cost when they come to the veterinary dentist. Their animals' teeth are almost perfect. So I'm going to proceed now into the discussion of malignant melanoma. I have a friend right now dealing with malignant melanoma on his black lab, and he contacted me. He lives up in New York, and he contacted me early on and said, oh boy, what do I do? And I said, find a veterinary dentist. Well, he had his veterinarian remove this malignant melanoma from the lip of his dog, the cheek pouch of his dog. And unfortunately, it wasn't totally removed. And he's in the throes of dealing with it. And I told him, for every problem, there's always a solution. And there's more and more people to help. The dentist or the veterinarian needs to work with a dentist or a surgeon and an oncologist. And there is a solution. Every single day of their life, they're healing. So malignant melanoma, unfortunately, is the most common oral tumor of all tumors in dogs. And it's very common in very many locations. So I'm just showing you some of the locations. Here is the central upper arch maxilla. Looks horrible. It's very advanced. This is right behind the canine in the premolar region. Very advanced. It seems that when they're more towards the front of the mouth, they're better tumors. The oncologist will stage canine malignant melanoma based on the size of the lesion. If it's less than 2 centimeters, it's a stage 1, 2 to 4, stage 2, and greater than that is stage 3. If there is distant metastasis, it's called a stage 4, and we'll take chest x-rays, 3 views of the chest to look to see if there's tumor metastasis in the lung. Now, you're going to have a wonderful oncologist coming on, and I'm hoping I get on that when that presentation is on, because there's so many common diseases, malignant diseases of dogs that are treatable. And I mean, number 1, lymphoma. Number 2, in the oral cavity, malignant melanoma. And unfortunately, my own dog, hemangiosarcoma, common diseases. And if you can catch them early, you can win. And if you don't catch them early, you can win. It's just harder to win and much more expensive. So surgical excision is a good idea. That last slide, I was just trying to show you need to be able to get 2 centimeter margins beyond the tumor. And my friend's dog, the black lab, they didn't get margins. It's very, very hard to operate the cheek pouch and get it to close properly. And so now the dog was on his 2nd vaccine. He was on the melanoma vaccine. And unfortunately, he called me up and says there's a lot of drooling. And I says it could be due to pain, but I says I'm worried it's probably the tumor is larger. And the oncologist reported the tumor went from 2 centimeters to 5 in 2 weeks. So they have to decide what do they do next, and they're working with the melanoma vaccine. So I'm not going to play oncologist. I'm just going to say that the prognosis is very variable. It's always uncertain, whether it's a 1 centimeter, 2 or 5. It's probably better if it's smaller. It's probably better if it's towards the front of the mouth. And surgical margins are really, really important. The prognosis isn't determined by us. It's determined by the patient. So that's all I'm going to say about melanoma. I am sure the oncologist will do a much more thorough job of that. Pets can get dental care. I want each of you to be an advocate for doing an oral exam. If you brush the teeth every day, you'll easily see changes in the mouth, whether it's discolored teeth, whether it's broken teeth, whether it's periodontal disease, whatever it is, you're going to start seeing these things, and you're going to see them early, and you get help early. You don't have to be worried about anesthesia when you learn more information. Knowledge is power. So don't be fearful of anesthesia. Be knowledgeable and work with whoever you're working with to get the dental care. Owner involvement, if you look and find things early, the costs will be lower. And there is a site where veterinary dentists are available. It's www.avdc.org. Sorry for popping through there. www.avdc.org. And remember, there's always a solution. I'm probably 15 minutes over. I know there's questions. I'm going to ask for just a 3-minute break to run and empty out the coffee. And then I will answer as many questions for as long as anybody wants to have questions answered. I apologize in advance for showing this breed, but it's my weak point in life. So if you have questions, I'm all in. This dog has questions. I'll be back in 5 minutes. Matt, is that good with you?
We're great. Everyone can take a break, and I'm working on organizing the questions a little bit here.
Okay, excellent. I'll be back in less than 5.
Thanks, Dale.
You're welcome.
If any of you have started doing an independent recording of this session, could you email me after the fact? There's 3 puppies at our house right now, and there's a little bit of a commotion, and I forgot to hit the record button at the time that we started. I've got most of it recorded, but just in case, if anyone did record, please contact me privately, okay? And my email is mgbnp as in Nancy Peter 1@gmail.com. And if you guys want to unmute right now and have any dialogue between you guys for just a couple of minutes, feel free to do so. When Dale comes back, I'm going to ask you to remute yourself so that we can have a quick dialogue with Dale as well.
It's a great presentation. I really enjoyed him. He's so personable and knowledgeable.
Thanks, Lori. It's good to see you this morning.
Here at the beginning, I just asked the question if you can get a copy of the recording.
And I don't know if you saw my message that I just put in chat, but our June session is going to feature an oncologist from UW-Madison, and she is specifically going to be talking about melanoma, hemangiosarcoma, and another common cancer that I can't remember right now.
Oh, good.
Thank you. I'm glad to hear more about the malignant melanoma, considering Morgan's second year passing was this week from it. But thank God she didn't have the oral version, because,
Yeah.
you know, just amazing she lasted 17 months without treatment. So hi, everybody from St. Louis.
Hi.
Is he on potty break?
Yeah, he is. We need to ask him, was he a good boy? Do you need a biscuit when he comes back?
Good boy. Chloe failed. No, there's too many leads and acorns and sticks and.
Thank you, Carol. Please, you guys, you know, if you can stay on, because Dale will take questions as long as we can do them, but don't feel like you have to remain on. Again, this part is all being recorded and the questions and the answers will be on board. Matt, are you present? I think he might be doing the same.
Yeah, I'm here. I'm here. No, I'm here.
Do you think that we might be able to get things up by this week on the website?
Yeah, I think so.
Okay, awesome. You're awesome, Saint Matt.
What is the, can you, what is the website URL? Can you type that in for Chris is asking, was asking me a direct message.
The website for the Scotty Rally?
Yeah, it's just,
Sure. Oops.
hold on, I'm trying to pull it from my line here and I'm just gonna paste it in.
So I'm back and you don't have to keep saying bad things about me now.
Well, we have one primary question we have to ask you, Dale. Do you need a cookie? Were you a good boy?
My wife has found that treats work very well to get my behavior back in line. But, you know, I'll never, ever forget a trainer saying to me, you know, if you get a pit bull from the Humane Society, they're great dogs, but they are genetics what they are, and they like to behave in certain ways. You can do what you want to train them not to fight and bite, but someday that can haunt you. So you can give treats only so much, and I can't get over how important it is to pick the right breed. And it seems like going to the Door County Scotty Rally, what I've learned is that the Scotty is a hot dog, and who can have just one hot dog? You know, I mean, I don't think the only times I remember seeing somebody with one Scotty is they had the sad story about something that happened to their dog. It's just so true. They're wonderful dogs. They're very, very unique. And I'm sure Jody Hergert Andreessen can train them very well, but you can't train them not to be a Scotty. They are what they are.
Exactly.
And I mean, they're wonderful dogs. I'm amazed by what I've learned coming up there. So.
Thank you, Dale. Dale, do you want to advance your slide? Do you have another one after this?
You know, let's just take a look here.
The end slide with the.
Here we go.
There you go.
Yeah.
Thank
So
you.
there's the upcoming meetings. I overheard you say a little bit. There's your lymphoma, melanoma, hemangiosarcoma. I lost a dog to hemangiosarcoma.
Yes.
So that's extremely common in the golden retriever. I have seen so many melanomas, it is ridiculous. But I'll tell you, and I didn't say it in the presentation, that vaccine that's available has saved so many lives. It has done amazing things. So just like coronavirus has taught us a lot, our research has taught us a ton on melanoma. Melanoma used to be the worst oral disease possible. And honestly, I'll say it's very treatable if you catch it early enough. So anyway, Matt, what have you got for me for questions?
Yeah, so try to group a couple things together here. Can you hear me okay?
Yes.
Dale, you can hear me?
Yeah, I can hear you.
Okay. Sorry, turn your ear to the thing. I didn't know if I need to start yelling louder here. So a couple questions. One of the things I think answers a few questions here said, can you repeat the website to look up safe toys? Somebody else asked about which chew toys are safe. Somebody asked if it was okay for dogs to chew ice cubes.
Okay.
So
excellent questions. Okay, so let's address that. I had that picture of all the products that are very bad. Hard objects damage teeth. So when people want to get a chew for a dog, what do? They want something that'll last. And the greenie, those little striped things that they chew that acts like dental floss, they're quite expensive. And my dog would go through it in about 4 seconds. I mean, ridiculously fast. So we all want something that lasts. And unfortunately, most of the things that last are hard. Ice cubes are very, very bad because they're hard, but then they're also unpredictable and they cause teeth to chomp against one another and split and crack. So ice cubes are a very bad idea for people and for animals. But I used to use, when I came up to the rally, I used to say if you're going to give your dog something to chew, you should be willing to take that and wrap it against your knee. So if it's hard, you're probably not going to want to wrap it against your knee. So hard objects will break teeth, period. But the Kongs that I showed, all those colorful items, they're rubbery and they're flexible. And there's other flexible things, that Go Nuts. There's other products like Go Nuts, gonuts.com. Those are all, they're safe. And when the Go Nuts becomes unsafe, it creates a color and you can send it back to the company and they will replace it. Now, the website was www. V as in veterinary, O as in oral, H as in
Where?
health,
Under the five
B
corners? Yeah. No, that's
as in
water.
council.com. So the veterinaryOralHealth.com, that group, they actually provide a certificate of not really safety, they provide a certificate of effectiveness against bacteria that cause periodontal disease, calculus. And so the removal of calculus, and that's what that VOHC does. There is nobody that'll certify everything being safe because in this society, we have people that'll challenge everything like that. And so if I put on my website, all these are safe, and somebody has an animal that breaks its tooth, somebody's going to say, hey, you said this. But I'll tell you, if it's flexible, it's safer than if it isn't. Whatever you give an animal, they can choke on. So the problem back away was, what was the product that dogs were swallowing, and they'd be at the Fox Valley Referral Center and other ERs where they have this foreign body in their GI tract. Oh, I can't remember which one it is, but greenies, the early greenies, they used to have a problem with that. And then they reformulated greenies so that you could put a greenie in a bottle of water or in a glass of water and it would dissolve. So I don't have any site for safe products, but my website does go over some of the things that were on here. And my website is www.mypetsdentist.com. My goal is zero to advertise. It's just to help you guys out. And honestly, if you will brush the teeth, you will see problems. You'll get early diagnosis and early treatment. There is always a solution to every problem: periodontal disease, broken teeth, and tumors. So ice cube's bad. What else, Matt, was on the list of chewing things?
That was it. Somebody asked about ice, and a couple of people asked about safe toys. I just put the link in the chat for your website. Oh yeah, somebody did ask about tug of war as well.
Okay,
that
good.
caused problems.
In my presentations, I always tell people I don't recommend tug of war. From a number one, in my own perspective, I think it generates a behavior that's a bit undesirable, actually. When I was a young veterinarian, I used to try to convince, it seems like guys tend to want to wrestle with a dog, and that creates an aggressive dog, I think. I'm not Jody Hergert Andreessen, but I do think that in general, rough activities create rough, they learn how to be rough. And I just don't think that's a good idea. So my own opinion, whether it's true or not, I think tug of war is bad, but certainly it's putting pressures on teeth. So I treat dogs that are Schutzhund dogs, dogs that actually are attack dogs trained to go after things. And, a dog hanging from a sleeve is not a very safe oral habit, but it is what it is. And I can help them, people. If you choose to play tug of war, you're just going to have some broken teeth, and you have to deal with that. So.
Thanks, Dale. We have some questions too about toothpaste or enzymes in water. I know you had showed the Oravet chews and a couple other things, maybe some pillows, yeah. But what about toothpaste? And then one of the toothpaste questions asked, is it okay to use your finger instead of the toothbrush if that's, I guess, maybe the way that your dog
it's a very good question. It's a good question. The reason that toothbrushes have bristles is that the bristle is designed to get under the gum line. So when we go to our dentist for ourselves, the hygienist will measure pockets. And if you're lucky enough to have 2 millimeter and 3 millimeter pockets and not 4, 5, and 6, then you don't need periodontal surgery. Well, the goal of toothbrushes for people and animals is to get the ability to whisk the bacteria out from in between the tooth and the gum. So if you use your finger, you're not going to whisk anything out. So the purpose of a toothbrush, and gauze is another one. Veterinarians will say, well, use gauze. It doesn't do any good. Removing bacteria from the crown of the tooth has little benefit to preventing periodontal disease. The toothbrush itself will actually flick the bacteria out of there. Now, to the issue of toothpaste, you really don't even need toothpaste at all. Toothpaste, in my opinion, it has some antibacterial and enzymatic activity, which has a minimal benefit, but it's the physical removal of plaque bacteria. Periodontal disease is the #1 disease of all diseases in all animals, and it's caused by plaque bacteria. And plaque bacteria is ubiquitous. It's everywhere. So if you can keep the plaque bacteria out of the gingival sulcus, the area between the gums and the tooth, you will control periodontal disease. That's why we brush the teeth, to remove plaque or control plaque. That's the #1 goal. So the Verbac is a company that most of the veterinarians have toothpaste, their toothpaste. It doesn't have an oral seal or anything. I think there are some toothpastes that have the VOHC seal of health. You could go on that site. It's an ever-changing website, and there will be products there. But toothpastes are not necessary. What you don't want to use is human toothpaste, because some of the phosphates, they'll swallow that, and that can cause GI upsets or ulcerations and other problems. So human toothpaste is a bad idea. Then people ask me, should I use sodium hydroxide? No, I wouldn't use sodium hydroxide in my mouth, because that very basic product can cause other GI upsets. So the best toothpaste is probably a veterinary toothpaste. You know, doesn't have to be from your vet. You can get it online. There's a lot of reasonable products out there. I don't know of any toothpaste other than human toothpaste that are particularly dangerous. So, and I don't know that there's any studies that show that one toothpaste is gigantically superior, although the VOHC may have done those studies. I'm not on that committee. I was in charge of paying for the committee at one time, but I'm not on the committee, so I don't know. So that's a good question. How do you brush teeth? Circular fashion, gentle. Do you use toothpaste? Probably better than not. You know, toothpaste tastes good, and that kind of is a bonus for the animals. I think having treats is really smart, making it a real favorable experience, and never rushing it, and never being patient and gentle and understanding. And if it's just not a toothbrushing time, try it a few hours later. That's the key of toothbrushing. How about the next thing, Matt?
How about people have asked about enzymes in water, or like the Vetradent spray? Is that a good thing to use, like in along with brushing? Do you recommend any of those? And then tied to that, I'd say there's one other question here where somebody said that their Michelle mentioned that their vet had told them that the dog's own saliva cleans the inside of the teeth. And I know in your presentation you said if you can only manage to do the outside, then do that. If they wouldn't have let you inside, does saliva take care of most of the inside of the teeth?
So, you know, that's something I've been telling people for years and years, but in reality, it helps minimally, but really, if you could brush the inside of the teeth, it would be better. I think the key is that this is a training procedure. And if you start out in getting the outsides of the teeth brushed really well, that's going to really help. And in my video on My Pet's Dentist teeth brushing video, in that YouTube video, my office manager actually shows brushing the inside of the teeth. We used to say that you don't have to do the inside of the teeth, but I can tell you that I have clients that come in regularly that brush the outside of the teeth and not the inside, and I see a lot of accumulation of debris on the inside of the teeth. So even though I've been the perpetuator of that nonsense, it's kind of it isn't nonsense. The saliva does help, but it's not a panacea. Everybody in this room, brush our teeth twice a day, and we go to the dentist, and they find problems. So guess what? Teeth brushing helps reduce plaque bacteria, and if you can do it on the outside and the inside of the teeth, it's even better. But you still need professional care. So there's no way you're going to brush the teeth and never need to have the teeth cleaned. That's foolish. That would never work. So you're working with your veterinarian or your provider to be able to keep the teeth clean. The other thing I think is a big mistake is trying to use scalers and scraping teeth. I think that can create damage to the gums and the periodontal structures. I think that is a mistake. I get a lot of human dental hygienists that say, oh, I clean my dog's teeth all the time. And what they're doing is they're removing the calculus, and the teeth look white, but underneath the gum line, the bacteria are living there, and that's where periodontal disease is happening. Nobody is measuring periodontal disease at the crown of the tooth, the tip of the canine. When your hygienist goes in your mouth, they're not saying, hey, Matt, you've got to brush better on the outside of your tooth. No, they're trying to say you're getting pockets that are going deeper and deeper, and that means the bacteria are causing destruction. So periodontal disease is a disease of bacteria. It's an infection that progresses and causes damage to the structures that support the tooth. The first thing that goes is the gums. They get inflammation. What I realized in my presentation is I showed you broken teeth, I showed you tumors, but I didn't really show you periodontal disease. And periodontal disease is very evident. It starts with red gums, which is gingivitis, and then it progresses to periodontitis, where you get deeper and deeper pockets and the periodontal ligament gets wide. And then you start getting loss of bone that supports the tooth, and then they get wiggling and then they fall out. So I went to a dentist when I was a kid, and he had written right on his wall, ignore your teeth and they will go away. And he says, if you don't brush your teeth, they will fall out. And so the same is true with animals. If you don't pay attention to the teeth, they will go away. So brushing the outside of the teeth is perfect. If you can get the inside, it's even better. And you should get dental care. I think that truly with a Scotty and that size, the mesotecephallic side breeds, I think you can probably get away with every 2-3 years if you really do a good job of brushing. But some animals need to have their teeth cleaned every 6 months, and some people do. So it's a little variable. I think I skirted around your question. Enzymes in water. I don't have any comment one way or another about enzymes in water. There is a product called Healthy Mouth that can be put in the water to help, and it is shown by the VOHC to be effective. It's a product that's from Canada, and I think you need to get it directly, and you go online and find it. So that's called Healthy Mouth. And sprays, there's a product called Liba 1, 2, 3, and it seems to do a good job of destroying calculus, but there's no evidence that it does work under the gum line. So my worry is if you scrape the teeth with a scaler or you use a spray that destroys calculus, it may not eliminate the problem underneath the gum line. One thing that is commonly presented to me is people that believe in using raw diet. And I will say, I've been kind of like the Fox Valley referral ER vets, they've been against raw diet for various reasons, salmonella, blah, blah, blah. But the reality is the dogs that I see that are on raw diet do have a healthier mouth than dogs that don't. So I'll leave it at that. Yes, they can have problems with raw diet, but you can have problems with our regular diets too. I'm not a proponent for or against raw diet. I am kind of against Liba 1, 2, and 3 in different sprays, but I'm not the wherewithal or know-all. I just know what works and what doesn't. Raw diet helps. Those chews that I showed Sentinel having, Vegadent, and some of those products, they work really well. Other questions?
We had a couple questions about extraction, and one was how do you decide when baby teeth need to be removed surgically? Is there another option to that? And then Michelle had a question about, is it common for primary care vets to extract fractured teeth? Is there another way to preserve them?
Okay, so as far as deciduous baby teeth, when do you extract them? Honestly, that should be a very proactive procedure. If you ever see two teeth at the same time, two of the same type of tooth at the same time in the mouth, something should be done immediately because a malocclusion will develop. All those pictures of the canine teeth, they're classic. When the baby tooth is in, the adult tooth is going to be in the wrong place. And if you get the baby tooth out soon enough, the adult tooth may shift into the correct location. And so if you wait for a year or two, it's going to be a malocclusion, and there's going to be a lot of cost in either moving the teeth orthodontically or removing them or changing them. So really, if you've got a Scotty and he's got a baby canine and an adult canine, they need to get in right away to your general vet. And yes, general vets can do a good job of extracting teeth. I think all of them in Door County are good at doing that. And honestly, like all of us, whatever we do, if we're a mechanic and we don't work on that particular thing, we shouldn't do it. Some veterinarians won't extract any teeth because they're not comfortable, and that's fine. And some veterinarians will try things that you wouldn't think they would. So everybody needs to be responsible as far as what they can and can't do. And if I was an owner, I'd just say straight up, is this something you've done before, comfortable doing? What's the outcome? If I had an oral tumor in my mouth, I'd be asking questions about the prognosis and who do I see? Have you done many of these? What's your outcome? So I think that's always a valid question. So yes, general vets can do anything that a veterinary dentist can do. The veterinary dentist is trained to do it better. And most veterinarians work with the veterinary dentist. I don't think I think most veterinarians in our state have communicated with us, and they'll at least ask us, how should I handle this or that? And that's collegial relationships. It's just being, we're all in for the clients and the pets. And so I think the answer to who should do what should be a direct discussion with the vet. And if they're comfortable, good. If they're not comfortable, good. So Matt, what else did you ask there? Who should extract when? When should be immediately with baby teeth. They need to get out now.
The other one, the extraction one was if there's fractured teeth, is there a way to preserve them other than?
Good question.
So
root canal therapy is a real logical way to. There's root canal or endodontic therapy. Root canal isn't the only. There's a few different endodontic procedures to save teeth, and the purpose of saving them is to retain function. So when we look at teeth, some teeth are more important than others. The canines and the incisors and the premolars, I would say an incisor is much less important than a canine. And I would say molars, the actual chewing teeth, are very, very important. So based on how important a tooth is and what the purpose of the dog is, would help direct the decision on should I save it or shouldn't I save it? And then the question of how much and the question about prognosis all come to play. If I do a root canal on this tooth, is there a 50% chance it'll work? I think the chance is probably 85–95% it'll work. Honestly, the reason the tooth broke matters most. So if the tooth broke because he's chewing something hard, doing a root canal, he's going to chew something hard and break the tooth again. So that's back to the behavioral thing, or actually the good ownership thing. Don't give them things that'll break teeth. So I would save, if it were my dog, I would save teeth that are important, which are probably the molars and the canines, and the upper fourth premolar is the most important tooth in the mouth. And it chews against the lower molar, first molar. Those are absolutely the two most important teeth in the mouth. And the next are maybe the canines and others. So importance of the tooth, how badly, what's the extent of the damage, what's the prognosis, what's the cost. If I can't afford it, it's not logical to do it. So it's okay not affording something. That's human nature, you know. I'd like to have a Ferrari, but I don't. And I can't, you know, it just is what it is. So save the teeth that are savable and save the most important ones, okay?
There
Next.
were a lot of questions in the middle about melanoma and various cancers. I think maybe something that you could talk about that could be helpful to the group is Lori asked a question about the signs of melanoma, if the tumor is in the back of the mouth or throat, where it's hard to discover it. I know you had talked about the different discharges, saliva and nasal and eye discharge even.
So unfortunately, the reality is, you know, as veterinarians, we look in the mouth and say, how could they have let it get this way? Well, the reality is they didn't see it. They didn't know. And the reason that we see a lot of these animals with advanced disease is no one looked. I mean, the vet didn't see it. They didn't look either. And so honestly, I think that you have to have a good relationship with the vet and make sure that, you know, it's great to have something low cost, but you might get what you pay for. I know of a veterinarian that their first exam is $150. And, you know, you have to take the time and you have to be patient. You got to be able to look in the mouth. These melanomas that pop up in the back of the mouth, nobody sees them. They're on the palatal side. They're black, like maybe the palatal mucosa, and they're sneaky. And so you don't see them. So unfortunately, you know, anybody can make judgment on somebody else, but the reality is they're great pretenders. The only way these animals present to us is maybe they're dropping food, like, or they're drooling more, or they're sensitive on the side. Those would be signs you could have a broken tooth or a tumor. Those are the signs. If they're not eating normal, if they're eating on the right side, there might be something wrong on the left side. And if you look, this is a good point. If you look and there's more calculus on one side than the other, there's probably a broken tooth hidden underneath there, or periodontal disease that's painful underneath there. So that question Lori had is a 10 out of 10. That's a great question. So honestly, if you look at your animal's mouth regularly and you make it a habit, you will see things early, and you'll see discharges and you'll see swellings. And the swelling might not even be a tumor. It might just be trauma from what they chewed the other day. They got an ice cube or they got something hot. But if you see a change, it's worth at least noting it and seeing if it's there tomorrow. And if it's there the day after, you better get a hold of Michelle or Matt or somebody, and they can say, get a hold of your vet. And, you know, I mean, share it with your friends. What's going on? Do you ever see this? Yeah, I do. Does it smell like that? Does that smell right? If it don't smell good, it's not good. I guarantee that. And drooling is a very, there is a chronic problem when there's drooling due to disease. Bleeding from the mouth is almost a sure sign of periodontal disease and or tumor. So I could talk a long time about oral melanoma because I've seen a lot of them. And melanin is a black pigment. And so black pigmented tissues, animals with black pigmented tissues tend to have melanoma more than ones that don't. And so the breeds that you can think of that have black tongues, they tend to get melanoma of the tongue. And so it's good to know that tongues have little papilla, and some of them are normal and some of them aren't. So if that sucker is getting big, it could be a stick lodged in the tongue, and it ain't a tumor, it's an infection in the tongue. So So all I can say is look regularly, and if something's changing, look some more. But melanoma is sneaky. Very, very sneaky.
So we had a question Chris sent me directly asking, is the melanoma vaccine given when melanoma is seen or before as a preventative, or maybe both?
Good question. No, melanoma is a treatment. That vaccine is a DNA vaccination. And it's, I first was introduced with it in Milwaukee. There was a researcher that was working on it. We saw amazing benefits to it. I saw a dog that had a lungs full of tumor, of metastatic disease. And on the melanoma vaccine, the lungs became clear, 100% normal. And so that's a really good question. No, there is no vaccine against melanoma, unfortunately. The reason the research was done for melanoma was to help treat people with melanoma. Melanoma is the #1 oral disease, oral cancer in the mouth of dogs. And fibrosarcoma is #2, and squamous cell carcinoma is #3. But there is a 4, 5, 6, 7, 8, 9, 10. And most of them are benign tumors. So keep that in mind. Just because you have a tumor doesn't mean it's time to get the violin out and start crying and looking for dogs. It's time to get help and diagnose. Diagnose first, treat optimally. So we got to find out what that lump is. It might be a foreign body causing an abscess. It might be a tumor. So no, the vaccine is only to treat the disease. And truthfully, the vaccine is really designed to treat the disease that's floating through the bloodstream or through the lymphatic system. Hopefully, whoever was responsible for surgery actually removed it. And if they did, we win. If they didn't, it's going to come back to haunt you, and it may metastasize and whatnot. Unfortunately, I've operated dogs and we got complete, the pathologist says, yep, clean margins, lymph nodes clean. And then 2 months later, you got tumor in the lung. Why is that? You must have lied. No, you didn't lie. It's just like human disease. That's the way the ball bounces. So if you've got tumor cells in your lymphatics and the lymph nodes, or maybe they, everything has a limit. You take chest x-rays, the vet says it's clear. Well, the vet doesn't have perfect eyes. The x-rays don't have complete pixelation to really diagnose. So everything comes in stages. An x-ray is what you have right now, but it really represents what's been going on. So everything has limitations. So the fact that the vet got clean margins is a great thing, but there may be tumor cells in the bloodstream. So if we can do ancillary treatment on top of the surgery, be it melanoma vaccine, I've seen dogs live 5 years. And if they wouldn't have been treated at all, they might have gotten 3 to 6 months. So your oncologist from Madison is going to give you a lot of good information, more accurate than mine. It's changing a lot, and I've seen just amazing good results from the vaccine. And the oncologist is going to say, well, don't let them blow that prognosis up too good. It isn't so good after all. I mean, it just is what it is. And they know, they use staging to give you a better idea of prognosis. So we have to love them enough to let them go too. And that's the reality of life. We all have to make decisions, and informed decisions are the best decisions. So the message of this presentation is to find a problem and then get a diagnosis and then treat optimally and then get your team of people together, be it the surgeon, oncologist, or dentist, or whoever. So I'm sure there's more questions, Matt.
I want to give Nan a chance to maybe unmute herself and ask. She had a couple questions, and I apologize, but I'm seeing one of them and not the other one about oral care, and I think the other one was prosthetics with fistulas. And so I just wanted to give her a chance maybe to ask what she wanted to ask.
Yeah, she's now 10 years old. She had surgery almost 2 years ago, a precancerous squamous cell in the mouth that we found during a dental checkout, dental procedure, cleaning. She went to the University of Illinois. They totally took care of the cancer. We have not had a reoccurrence, but we ended up with 2 fairly sizable oral nasal fistulas, which, we actually take her food, her canned food, we make it in meatballs, hand feed her. We've not had any aspiration pneumonia. She's a pretty happy girl, but I just look at the mechanics. Is there any prosthetic thing?
Yep.
Oh, I want to hear.
Yeah, there is. So I don't know if Sandy Manfra was the doctor involved in that surgery.
She actually consulted on this because she is not the gal that did the surgery, did the secondary surgery. Unfortunately, I hate to say this, we had plain old surgeons to begin with. When we got to dental surgeons, that's when because we've tried repairs, but Dr. Manfra was consulted on this and has followed it.
Okay, so it turns out that I've been involved in a lot of surgeries secondary to board certified surgeons doing surgery, and the mouth isn't their favorite area. Mm-hmm. Give them a knee and, it's pretty quick and yeah, very profitable, but the mouth is a tough one. Just so everyone else knows, it turns out that oral nasal fistula tells us that this squamous cell carcinoma that they dealt with was in the upper arch, not the lower. It was somewhere in the maxilla. Was it towards the front or back?
Back.
So the back is tough. Mm-hmm. The back is tough because to close an oral nasal they probably removed most of the teeth in the area.
They did. All the top ones. I mean, she's got front, top, and her bottom, but nothing in the back on the top.
Okay. Well, it turns out that location, it's hard because closing it requires some fairly major sized flaps. She's an older dog, and it's like anything else. Does this problem need to be fixed, or can we feed them without, if we haven't had? So there's a concept of morbidity and mortality. And mortality, we all know, means the end of life, and morbidity means discomfort. And so if one were to go into your dog and try more flaps and surgeries, it's very possible. Sandy Manfra, she created some very good techniques for closing fistulas in the back there. And so I'm sure that's been looked at. Unfortunately, you're dealing with the soft palate and the hard palate, and it's tough. So obturators work well in the hard palate area, in my experience, but in the soft palate area, not so good. Okay. I think that an obturator, the problem is, so what is an obturator? An obturator is a prosthetic device that you would place to block a hole, is what she's looking at doing. Mm-hmm. She's got basically a communication. Oral nasal fistula, by definition, is a hole between the mouth and the respiratory tract. So a plastic device could be developed to fit in that space. But the question is, will that create more morbidity? Will it create more discomfort for her and make a less happy dog than you had before? Because right now, believe it or not, she's breathing through that hole too. Her respiratory tract is breathing through her mouth, and it works for her. So the fact that she hasn't got chronic respiratory disease and she's doing well makes one have to say, do I really want to go to something like an obturator? Obturators work on the hard palate, in my experience, more towards the front of the mouth. Mm-hmm. And what's nice is you can take them out and clean them and put them back in. And in the back of the mouth, you can't. So I think an obturator in that situation is probably not a good, not a real good idea. it's a big exercise, a lot of expense, and maybe more discomfort for the dog, but I don't know. You certainly could ask. In veterinary dentistry, there's people that aren't comfortable with things, just like the veterinarian. The veterinarian might be comfortable extracting teeth and might not. There might be some veterinary dentists that don't like to do oral, do major maxillary surgery, and then the surgeon would be better. So, like you said, unfortunately, the surgeon did it first. Well, maybe not so unfortunate, because there's a lot of veterinary dentists that don't want to live in that part of the world either. So it really goes back down to who's comfortable doing what, and what makes sense. And so your next step, there is somebody in Michigan that, and I don't know if they're still working, but they do a lot of maxillofacial reconstructive surgery. That's a boarded surgeon. And I'm sure Sandy Manfred knows who that is. Sandy is essentially retired now, so she isn't one that's going to do work on that. But I think, again, we're in a community and we have to ask around. And so if this oral nasal fistula, if you want to investigate it, I bet there's a way to do it. I was asked to do a study with the Mayo Clinic, indirectly with the Mayo Clinic, in research for cleft palate, and it was shocking, some of the stuff they're able to do. So my message isn't that I'm the one. The message is that there's a lot of new stuff coming, and there's a lot of new kids coming up on the block, and they're probably better than some of the older ducks that are around. So a lot of new stuff. So if your dog would benefit from it, most people would tell you whether they think it would help or not.
Yeah.
And so then you would decide to go from there. What other question, Nan, did you have?
That was really it. She, we have pretty much decided, as long as she's doing well at the age of, well, she's 10 and a half now, we're not going to put her through anything else,
Yeah,
the
yep. And an obturator back there is going to be very hard to manage.
yeah,
And it may really create problems for her. And you won't see it. So what did we talk about a minute ago about melanoma? They pop up,
Yeah.
nobody sees it. That obturator could be causing all kinds of trouble back there.
Yeah.
It's a foreign body in your mouth. Now you got new problems, and you can't see them. So
Yeah.
do you really want to have anesthesia to see how the obturator is working? I don't.
it took me a while to get the guts to go in and brush teeth, but I am doing it, and she's good with it. And I guess that they've said because I worry about the aspiration and all that, but the good news is they said, or the bad news is they're large. The fistulas are large, but the good news is they're large because she's able, if she sneezes, she clears them,
Yeah.
So
Yeah.
we have a special needs girl, and that's okay. But
Yeah.
I appreciate your input.
All right. Anything else, Matt?
Thanks, Nan. Thanks, Dale. Yeah, let's hit two more things here, and I'm not sure, maybe you can answer this one quickly. Lori has a question about missing enamel. Is there anything that can be done for missing enamel? Should something be done?
This presentation wasn't about that, but I showed pictures of it. It can be missing because it didn't develop. It can be missing because a lot of enamel defects, enamel hypomineralization, hypoplasia, is due to developmental things. Basically, enamel fractures, they can be restored. And so there is restorative dentistry. A general practitioner isn't going to likely be able to do that, but it's not difficult. If there's many teeth with it, it's real questionable whether that's a cost-effective thing to do. But I have a guy I trained that is amazingly good at that kind of stuff. Very, very effective restorative dentistry. The beauty is that human dentistry is all about aesthetics, and veterinary dentistry is little about it. But this guy is really good, and you can make those enamel defects completely not seen at all. They can be done very well. And then there's crown therapy. Crowns can be put on them canines too to protect them. Others?
So the last question here I think we'll take is from Bob Grant, who asks, does bad breath mean mouth/teeth issues? And I can say from the 2 dogs that we have, I know that GI issues can also be part of that. If you think about even humans, maybe where gas can come out both ends. Same thing with dogs. We have a burping dog.
Sure.
Breath can be
Sure. I
horrific.
mean, I would say that if you've got bad breath, there's about 100% chance there's periodontal disease, but they also could have some kind of a GI tract disease. You know, sulfur, stink comes from sulfur, and mercaptanol, those kind of products, they actually have meters that measure that stuff. And yeah, it could be anywhere in the GI tract, but periodontal disease is that #1 disease, and it's so prevalent that you're guaranteed you have, if you have GI tract gas from somewhere else, I'll bet you also have it from the mouth. The mouth, the littler the dog, the more gas is going to come from the mouth because you have the more periodontal disease. It's almost a guarantee. If it smells, there's a problem. I think that wraps it up.
I think that's a great thing to keep in mind for anything in life. If it smells bad, there's a problem.
Yeah, yeah. And if they're drooling and they're not using a side, there's something wrong. You need to get help. All right?
Matt,
Thank you, Dale. Yes.
this is Sue Franci, and I was calling in from a phone. I'm not on a computer, so I couldn't type a question. All I wanted to know, thank you, Dr. Kressin. This has been fabulous.
You bet, Sue.
I just have a quick question. How much are dental problems related to genetics? I mean, I got it. We got to check, we got to brush, but is there a genetics thing? Say mom or dad maybe had dental problems. Is that going to pass along?
You know, how much is a Maltese related to a Maltese? You know, so the genetics of being a Maltese means you're small and you're going to get trappings. So yes, but no, in general, I mean, yes, there certainly are some dental problems that are genetic, but very, very few. It's not in the real game. The head shape, the head size, that's going to relate to the fundamental reason you have periodontal disease: accumulation of debris and bacteria, and the bacteria cause the disease.
Right. Thank you very much. This has been great.
You're welcome, Sue. I appreciate that. I am going to call it a day.
What do you think? Break.
I've got other things I have to do. But Michelle, thank you.
Don't forget to turn your vacuum back on, Dale.
Yeah, I didn't think that would pop out of the room.
I think that was our first Roomba interruption.
Yep. Well, there you go. I recommend that the group continue these Zoomies even after you're back to meeting, because it'll elevate the quality of your group. And I'll tell you, you're always going to get people better than what you have now. I mean, there's always going to be better resources available. Look at what we've learned about coronavirus. You know, look at what we're going to learn about melanoma. There's always going to be another consultant that knows more. So I think that if you could continue some form of a format like this, everybody will win, you know. And so the owners have to be advocates for their animals. There's just no doubt about that. All right.
Thank you. Thank you very much, Dale. And I want to just reassure you, we actually have plans to continue this. And part of the reason we're doing it is not only just because of COVID, but the rally has become so multi-layered that it is hard for people to do everything. And so, and the education stuff sort of gets little attendance because I got to be at the races or I got to be doing this. So we're putting this forum online, and our hope is probably going to continue, you know, well after COVID is and the pandemic has opened up things again, just because it's such a great way to engage people that are really interested. So,
and I hate to admit it, I hate to admit it, a lot of us attendees at the rallies, I don't see many people that are under 30. I see more of us over 60. And we don't like to admit age. And Matt, you're a youngster, but the reality is, you know, it's pretty hard for people to come up from Missouri or Illinois if they're 85. You know, I can think of some clients that, I can think of people that I met at the rally that would come up and see me in Milwaukee from Chicago. And I met wonderful people from that group. So, you know, all groups have to evolve, and I think you're doing it right. Thanks a lot.
Thank you. And as
Cheerio.
our Scotties would say, "Aroo!"
You know, I was going to ask for that, but we'll see y'all.
Thank you, Dale.
Yep.
Take care, Dale. Thank you.
Thanks, everyone.
You're
Thank
welcome.
you,
Bye
Matt.
now.
Thank you.
Bye.
Thanks, Matt.
Bye-bye.